Welcome. Step into the lab. On this podcast, we will be discussing the practices, research, science, and technology surrounding alternative medicine, where listeners will gain valuable insight and information with every episode. Just as a reminder, the Mind or a Lab podcast is for educational and informational purposes solely. All subjects on this podcast should not be construed as medical or legal advice. You should always seek out help from a professional provider. Thank you. Good morning, Sammy. Thank you for being on the Mind or a Lab podcast. I appreciate you taking the time out of your busy schedule to come on and speak with me on this passion project. I know that you are a professional at heart, and it was cool to connect with someone else that was brilliant in dance and outside of the dance community.
Thank you, Dorian. It's nice to see you, and it's nice being out here, so thanks.
Yeah, so, just to get things started, where are you from and where did you grow up, so you can tell the audience a little bit about your backstory?
Yeah, so I grew up near Chicago, about like 30 minutes south from the suburbs. I did not mean to move my hand like that was like something to say. Not very boring neighborhood. Yeah, I went to college in Southern Illinois then, and that's where I started my nursing degree. And then stayed out there actually to work in a neuro ICU for a few years, and then made my way up to Colorado. And so now I'm in Denver, been here for about 6 years now, roughly. Maybe more actually. And then spent a few years in PACU, which is recovering patients from surgery and anesthesia and all of that fun stuff. And then now I'm in mental health out here, so.
Interesting. So when you were growing up, was medicine a big part of your life, or were you interested in the science?
Yeah, if I'm honest, my parents did not go to college. I was the first generation college grad. College also wasn't really about. My dad was a mechanic, so he was into trade, and my mom was able to get a lot of like on-site and accounting, and so the conversation honestly was driven by myself and my high school teachers, which I think is pretty cool. Just trying to figure out what I wanted to do, what aligned with me. My dad ended up sadly having a heart attack when I was in high school. So that was my first exposure into medicine. And he's fine. He's alive and thriving right now. But that was my first exposure to nurses and what nurses did. And I think it was a little bit eye-opening to me that it was like, oh, nurses do what doctors, like in real life, do what doctors do in TV shows. And I thought that was kind of cool. And so I think that's really sparked my interest there. Science was the one subject that I was always kind of interested in and did well with. So I was like, okay, I think I can do that. Thankfully, it stuck. Nursing school is a beast of a program. I'm surprised I made it through because I was a little bit of a knucklehead in college. But it all played out exactly how it should have. It's fun. I wish I could go back to college now, where I'm like mature and like truly interested in these things. And now I'm doing like a lot of studying, and I wish I would have had that back then because I think it would have been a really cool experience.
Yeah, for sure. I think in hindsight, we always want to go back with the knowledge that we already know, going through experiences and maturity. And you don't really appreciate all of the labs that you're taking because you're so focused on getting grades. You're like, I got to get a 4.0 GPA so that I can get into X school, or I need to get all these references from college professors so that I can move up in the world. But if you were like actually enjoying the process and not having to focus on the bills that come with school and the grades, then I think a lot more people would find passion in what they do, and it wouldn't be so like focused on just having a career in mind. And I think people get into a creative zone once they get out of it, and it's just whether or not you act on it, right?
Totally. Totally.
Yes.
I think too. I think it's really easy to not see how school connects to your career because it's a different learning environment when you're in a classroom. How why are mitochondria going to make any difference in what I'm doing in paper, right? But then when you get there, you're like,
Yeah.
oh, I actually now I kind of get it. Like, like that would have been helpful.
Yeah, I was terrible at chemistry in high school, and I think it was just because I had a teacher that didn't make it fun. And then when I got to college, it was a different story because it was like, all right, well, I'm focused on, you know, talking about pharmacology in the future if I'm going to go into medicine, so I need to understand this. So then the perception of it changed, and it was something that stuck with me, especially when I got into biochemistry, where I started connecting the dots of like, okay, this is what's happening inside your body and all of the molecules that are interacting from the external world to the internal world. So, I think with just being able to, as you said, connect what you're actually studying to and put it in application, that's when the fun part begins.
Yeah, yeah, absolutely.
So, did you always want to pursue the medical field, or was this, um, after your dad's heart attack, was it just like, all right, this is what I'm going to do?
Yeah, it was definitely after that, and definitely more towards my junior year of high school. Not surprising, probably to you at all, but I was a competitive dancer all the way up to my year, and so I have a very obsessive mindset. That was my entire life prior. So, like, I did well in school. That was all of my focus to the end. So I think that's kind of why maybe I didn't have a whole lot of like big future dreams. So I was just kind of living in the moment with that. And so as soon as that ended, then I was able to kind of focus more on like, okay, what is my future goals as a professional and what do I want to do? And that's where nursing came up. So
And then with nursing, once you got done with school, what did you focus on more? What did you gravitate towards more?
the brain. Yeah, the brain. Yeah, definitely. I applied to a few different neuro units, but I was lucky in college. I was the only student that was able to do it just by chance. But I got to have 2 ICU rotations for clinicals, and I just loved the ICU. It was just such a different pace. I felt like there was just so much more to learn. And I thought that the nurses were just so attentive and calm and disciplined, and I really looked up to them. And so
Mm.
I knew it was a kind of a long shot as a new grad, but I really wanted to get into the ICU. And so I applied at the hospital I did clinicals at, just, since I had the experience. And I landed the neuro ICU job and I was so stoked. And looking back on that I learned so much there. The nurses there were just so talented and dedicated, and um, really taught me a lot of teamwork too. I think that was a really special unit that really collaborated and worked together and found ways to work together. Because
Mm-hmm.
it is really easy to just get lost in your room with your patients and not really come out and not really check on your peers. But that was just not the environment that they created, which was really cool. So, and then it was a learning hospital too. So we had a lot of residents and different levels of neurosurgeons working with us on the floor. And so they were a young crowd too. And so to work with them, and they were so excited with what they were learning that they were really quick to pass that knowledge on to us and quiz us at the bedside. If there was a symptom, it was always a test of, why is this happening, what do you think, kind of forcing us to really have a deeper understanding of what was going on. But yeah, back really fondly on that job for sure.
Yeah, the neuro department must have been fascinating. I think in undergrad, neurobiology was my favorite subject too, because it's just so fascinating that we have this supercomputer inside of our body that's dictating basically every moment, and the amount of thoughts that you have in just an hour is insane. And then just to carry that on and then act on
Yeah.
trivial like thought and then putting it together and creating something or actually like performing a task is just insane. And then biochemically it gets even deeper because everyone is not the same. So you got this cocktail inside your brain that's getting released and flooding hormones. You got neurotransmitters that are being released that create every action and every thought, every processing of information. So, what was the coolest thing that you saw in the neuro department?
So I would say that the coolest thing is definitely watching somebody come back from a stroke with TPA. It's something that if it's given like in the right time to the right patient, like, and it is a little bit of chance and luck. They can go from, full stroke symptoms, like they're probably not moving, a side of their body. They're not talking right. They may not even be conscious, to, you know, hour by hour, all of those symptoms resolving in front of you in real time. And they're getting excited. The family's getting excited. You're getting excited.
Yeah.
Really cool to see it just actually come back, especially too, because, on the other side, that's, a stroke from a clot. We saw a lot of brain bleeds and hemorrhagic strokes, and those are so much harder to, and it takes so much longer to get those symptoms to resolve and like actually see what somebody's baseline is going to return to. So obviously that gratification too of just seeing somebody get better finally, and seeing it happen so quickly is just, it was really cool to see for sure.
So, when, and then just to explain this to the audience, if TPA doesn't work, what typically can you expect from a patient when the medication doesn't work?
Yeah, so that's where clots are a little tough to manage too. So if the TPA doesn't work, that also means that they didn't qualify to go down to the cath lab to remove the clot. That again, just a special kind of clot, special kind of day. Like you just kind of have to meet the criteria, and sometimes the patient doesn't. And so, if the TPA doesn't work, then typically the symptoms that we see are the symptoms that are going to stay. And so, that can really suck. That's a lot to have to navigate for the patient and their family. There is still chance that down the road with rehab and things like that, symptoms can, get better and resolve, but the brain is very unpredictable and every patient honestly looks different. The worst part about a clot that doesn't resolve is that around day 2 into day 3, they then start to swell. And so the brain swelling, depending on where the clot is at, then intensifies the symptoms and may bring more stroke symptoms on. And it also puts you at risk of, spinal cord, or not spinal cord, but brainstem compression, if your brain's
Mhm.
well. And so if that happens, that can risk your life. And so at that point, we may need to go down to the OR and remove a part of the skull to allow space for the brain to swell. There's other medications we can put the patient onto. 3% sodium drips actually were kind of our go-to. It kind of helps pull some of the fluid out.
Mhm.
It's a waiting game at that point then to kind of see what happens if, after the swelling period, symptoms are going to maybe resolve a little bit, or kind of getting them through that dangerous point. But unfortunately, that's another piece that you have to tell the patient is, journey's not over. Like, now we have to kind of get through this dangerous piece, and what happens is very dependent on, the patient's response, unfortunately.
Mhm. Yeah, no, I saw um, during my time in the ER plenty of strokes that would come in, and more than likely, most of them would not recover, and they were just, these are elderly people that I saw often when I was working at the San Martin location. It's on the west side of Vegas, so it was definitely an eye opener, and then also looking at the symptoms that they would present with made a lot of sense because it was consistent, right? So it's amazing that just being slightly off biochemically in the brain can just like change everything and just cut you off as a human altogether. So it really starts to make sense that the seed of consciousness is in the brain, and we're always playing around and optimizing for that to be at its best health. So the next thing that I want to talk about is um, what is the hardest thing that you've had to endure during your time as a nurse?
Mm-hmm.
And what do you think? This is a double question, sorry. What do you think needs to happen for reform in healthcare?
Yeah. I don't know if it will be surprising or not, but honestly, I think the hardest thing is short staffing. And I know that sounds like kind of silly, but and I don't think that people truly understand what happens when a hospital intentionally understaffs. Um, because you have cases like these, and you have patients who, like, take my PACU experience as a example. Like, I had patients
Mm-hmm.
who weren't responding well to their surgery, or were just, you know, going to crump on me, or really just I couldn't manage their pain, or just various things that are really time consuming, and you want to be able to help this patient. Like, that is why we took the job. Like, I am here, I want to make you feel better, I want to make you have a good experience, I want to make you feel safe, because this is scary and nobody wants to be here. But don't have the resources to do that, and you've got several of those patients all at the same time, and you are trying to put a band-aid on a bullet wound at that point, just kind of racing to see who needs help first and what can I do. And you always feel like you're letting them down, or you're leaving that day just so worried that, like, did I do the right thing? Is this patient going to be okay? Or are they going to look back on this as being a really bad experience? You hold that weight, and I think that is what is ruining the bedside experience for both patients and staff at the moment. um, because that's not what we signed up for. We want to be able to actually do our job and do it well, and like be able to give everything that we can give and feel good about that, and not feel hopeless going into the next day knowing it's going to be a repeat of the past, just a different set of patients, and how am I going to get through this. And so it's just, it's profit margins. Hospitals are companies. I think that if there were actual laws in place that protected staffing, you would see a massive
Mm-hmm.
shift of nurses back to the bedside, because right now the trend that they're seeing is a massive shift away from the bedside. And I could say
Mm-hmm.
leaving the bedside saved my nursing career. I was completely ready to leave. I could not do it another day. I was trying to find any other avenue to like still use my degree in some sense, or even just go back and get a new one. But then I was thankful enough to stumble on where I work now, and it just was a complete game changer because they do staff better, and I do actually feel like I help patients, and I do get to connect with patients. That's exactly what I wanted to do. So yeah, there's a lot of work to be done there for sure. But
Yeah, I think you touch on something that is very serious and something that I took note of. I think the doctors that I worked with in the ER were always mentioning that even with physicians, they're short staffed, right? You don't have a lot of internists that are there to see all the patients that they're sending to the ICU. You don't have enough nursing staff to come in and attend to the amount of volume that starts coming in on busy weekends, especially during the summer.
mm-hmm.
So and yeah, that hospitals are companies, and that's something that I was unaware of, that they purposely understaff to um, make sure that they're keeping their margins in check, which makes a lot of sense because they're trying to survive at the end of the day. They're not making a ton of money to begin with because they're paying so much out to physicians, and then also the insurance game comes into play, and now the incentives start getting higher and higher for them to keep it understaffed.
Yeah, I would encourage you to look at how much hospital corporation CEOs make every year, and see if your opinion changes.
I'm sure it's disgusting.
Uh-huh. Yeah. Yeah, doctors do not make enough for the amount of hours that they put in. I will definitely go to bat for them on that. Um, and nurses are seen as an expense because we are not billable. So it is, we are not generating them any revenue. We are strictly a cost. And so that's where, your, your nursing staff, the nursing support staff, your technicians, your housekeepers, all of those are an expense. They are not generating revenue. So at that point, you have to look at how you minimize that cost in their minds. And so that's where a lot of that comes into play. Because I will tell you, there's a lot of billable services generating a lot of money. So yeah.
So, what do you think? Um, what do you think should happen as far as like healthcare reform? I mean, we we saw, especially after the pandemic with COVID, that a lot of people got cut from their jobs, right? And is there a replacement that is coming forth, do you see, to fill those positions?
No. Like even down to AI and things like that, I don't see that necessarily being a replacement.
Mm-hmm.
A replacement right now is using travel agencies, which travel agency nurses make a lot of money. They make about 3 times more than the nursing staff at the facilities do. So that shows you that hospitals can't afford to upstaff, pay people more, all of that kind of stuff. Um, they, I would say, should look at California. California, for a while, has been unionized, has mandated safe staffing ratios. They've put a
Mm-hmm.
lot of um, support teams in there too to ensure patient safety. So they've got, patient turn teams. They've got a lot more, crisis teams, teams for codes,
Mm-hmm.
things like that, which have drastically changed patient care. They're not seeing a lot of the negative impacts that hospitals outside of California have, with bed sores and infection and patients dying because they're not getting responded to fast enough. All of that gets wiped away. Um,
Mm-hmm.
and so you know, I think it's really short-sighted to only look at, expenditure and not realize that hospitals, if we cause an infection, we are responsible for, the payment and all the care for that infection, right? So that just increases costs later on. And so it's very short-sighted not to take that into consideration. I think it ends up saving you money in the long run, and it saves your reputation. It makes people want to come back because they had a good experience and they were safe, and maybe I'm now going to stay in network with these doctors because I had a good experience, right? It's, California has proven that it is possible, and I think a lot of nurses have actually really fled over to California too. Just to be able to work in that environment, even outside of the massive pay difference. Just to be able to work in a safe environment is something that I think most people really want. So,
yeah, for sure. I think that was a lot to take in because being out of the game for a minute, seeing that hospital side, medical field side, I'm unaware of all that. So thank you for sharing that knowledge and breaking that down for people to understand, especially when they go to the hospital or they go to clinics and they're wondering why it's taking months to be seen or hours if you're in the if you're going to an ER or quick care. It's because of this. This is the information that people need to hear so that they can understand that it's a game, and unfortunately we need to take care of ourselves as a society and a country. And the next question that I want to lean into is, what do you think people should focus on preventatively to stay in good health?
yeah, I mean, I think so many of us just take it a bit for granted, myself included. I mean, and I still find myself to be really healthy. I eat well, I exercise, and all those things, but did not manage my stress well at all. And you don't know which one comes first, the chicken or the egg, but I developed an autoimmune disorder that can be triggered by stress. And so, having that happen and knowing that I needed to take a step back and that health is not just physical, health is everything. It's all of you. It's, you can't have, physical health without the mental health. You can't, run yourself ragged, but still go to the gym and think that that is enough to, be considered healthy. Like, you have to take it from all avenues. But I think those are really the big three, is really making sure that you are moving. Movement is so important. You are eating well. It does not have to be 100% of the time, but just being more conscious with decisions, being more aware of what you're putting into your body is more than most, I think, are doing. And then also figuring out what works for you to unwind and, de-stimulate at the end of the day, making sure that you're not carrying that into the next day, making sure that you're not carrying that into your sleep. You're taking space to just relax. Because I think, especially in our culture right now, we're all hustling. We're trying to get as much as we can done while we're young and, get to where we need to be. But if you burn yourself out, there can be really lasting impact on your health from that. So, not being too stressed is so important.
Yeah, absolutely. I think you touched on a lot of good things there because when we think of health, we think in terms of our physical appearance and a little bit more on the immune system side, right?
Mm-hmm.
However, a lot of people don't take into consideration the mental health game. And that's exactly why I wanted to speak with you, because you are a part of that movement that is promoting good mental health practices and treatments and therapies that can help with brain health overall. So now I want to transition into that, and I want to ask, when were you first introduced to alternative medicine, such as therapy treatments using psychedelics, specifically ketamine?
Yeah. So when I was at a loss at the bedside, I honestly just needed a second job because I was not making enough. And so made my way over to the position in the company that I'm with now, and um, immediately fell in love. And my first week, they were like, "Hey, you have a ketamine patient," and I was like, "What? What do you mean? uh, you mean we're doing ketamine?" And so we go through the whole training. I read through, we have these really extensive guidelines that really break down exactly like what we're doing, why we're doing it, the psychology behind it, and all of that. And I was like, okay, this is cool. Like, this is really, I think, forward thinking, because this was pre COVID. It was probably right before COVID hit. Like, what would that be, like 2019?
Mm-hmm.
And so we administer it intranasally. Patient just, hangs out in their room. They do a pre-assessment for their depression. Um, but it was really interesting to see them, because they then get it twice weekly for several weeks until they feel.
Okay.
And I was noticing, and I was asking them too, like, how are you feeling? I would check in with them at the next med pass, and I'm with these patients for a really long time. So they definitely have that relationship component. So I'm able to check in with them, for weeks, and, and a constant. And so many of them were saying that it was just such a game changer for them. You could see that there was this, air of lightness back to them. Um,
Mm-hmm.
they were experiencing better therapy sessions. They were able to kind of dive a little bit more into some of the trauma work that's been kind of gapping them and keeping them stuck. And so it was awesome. And so I, was a huge advocate for it, really, really passionate about it. And so we've just continued to grow and grow and grow and grow with that at the company, and ended up opening up a unit to specifically give ketamine to our patients that I oversee. And hopefully, our plan is to be able to expand that into the community, and kind of offer those resources to more and more patients, because I think that's where we sometimes feel stuck in mental health. Is I can give you all the tools, we can do all the talk therapy, we can do all of the non-medical things, but at a certain point sometimes we just get stuck and it's not going to work. And so you also have your normal, pharmaceutical drugs that do work and are really needed for these patients. But sometimes that's not enough either. And so it's kind of figuring out ways to kind of break down some of those walls and some of those barriers. And I think, um, neuromodulation services is really what this falls into, is, ketamine,
Okay.
TMS, which is magnetic therapy, ECT, which I know sounds really barbaric from the old days, but it's not anymore. But doing those things to really help the brain chemistry and kind of get through some of those barriers is really been a game changer for a lot of our patients, and especially a lot of our like reoccurring admissions, finally being able to
Mhm.
really take some space and get home, and not have to come back to treatment. So yeah, it's really cool. Definitely the future.
So I don't know much about ketamine as a drug and its mechanism of action. So can you break that down in simple terms?
Yeah, so it's a dissociative, and that is why it's believed to be so helpful with major depression and trauma. There's still a lot of studying that needs to be done on exactly why it works. Um,
Mm.
it was found to be effective purely out of luck. They started giving it as an anesthetic for a lot of pain control, and for surgeries. Um, and patients who had depression going into surgery reported like weeks of improvement after having surgery. And so they kind of started seeing this trend of, hey, we think it's the ketamine. Like, let's see what this is about. But they still don't
Okay.
understand exactly why it works. Um,
Mm.
so that's the theory, is that that dissociative allows you to kind of separate from your thoughts and your trauma in a way that makes you able to finally like comprehend that a little bit. But there's still definitely some lasting effect with, whether that be, dopamine, serotonin, something later on down the road that is improved and it is still lasting. It doesn't last forever. It's something that patients, if it does help, they have to use a combination of other therapies. They have to still take medications. They still have to do other things. They cannot just rely on ketamine to get them through that, but it can be that push to really get them better and more stable.
So, who's the demographic that you primarily serve? Like, who are the patients that come in for this therapy?
Yeah, so it's mood and anxiety and eating disorder patients actually that we serve. All ages. If we have treatment resistant depression, that is very well documented, and we are, very confident that that is treatment resistant depression. We can give it to adolescents as young as 12. And that has been effective for some of them too. It's not, comfortable for all of them. And as soon as they say no more, we're done. Like we don't push that. But it has actually worked on some of our kiddos, and it has been effective. So definitely being able to offer it to all ages and trying to kind of hit patients before they, are kind of having those reoccurring admissions and things like that is kind of the goal.
Do you think that with these neuromodulation centers popping up, that there are going to be more services available to the public through the next several years?
Absolutely. I think this is our version of like a technological revolution in terms of mental health.
Mm-hmm.
This is where, there hasn't been a ton of significant change in mental health up until recent when we started kind of identifying some of these services and again trying to figure out ways to get over that hump. I think especially in Colorado, psilocybin is now available potentially. I think that there's still a lot to figure out about how sites can administer that and be able to utilize that and whatnot. But I think as the laws continue to kind of lift for these services and we figure out how to ethically provide them to patients who need them in a safe setting, I think you'll see more and more of those things. And I think that you'll probably see a lot of branches of the current services and just kind of figuring out how to make those better. But I think I would love to see those therapies become more first line versus, second or third line interventions because
Mm-hmm.
right now it's kind of you have to try least invasive things first. However, we're not seeing a ton of side effects, especially from ketamine and ECT definitely has side effects and should never be a first line unless indicated. But TMS really does not have any side effects either. They don't have the memory loss. They don't have anything like that. So being able to utilize those as more first line interventions to maybe reduce our, patients' reliance on, long-term medications, and maybe we don't need as many medications, or, maybe we're seeing them, get through therapy faster, or maybe never getting to the point of wanting to hurt themselves or having those like really intense painful urges, in terms of like self-harm or suicide,
Mm-hmm.
like that. I think would be probably beneficial. But yeah.
And then, real quick, can you break down TMS versus ECT for people that don't know?
So ECT is electroconvulsive therapy. It used to be obviously what you see in movies where it's super barbaric and a patient is, shaking and all of that kind of stuff. But ECT does induce a seizure. Back in the day, they used to essentially shock the whole brain. And that is what causes way more side effects. That is not what is best practice. So now it's focalized. It's, you are meeting with a psychiatrist based on your symptoms and based on your diagnosis and things like that. They map out exactly what should be utilized in that procedure. It lasts all of about 5 minutes. Anesthesia is used now, so it's way more comfortable. Back in the day, they did not use anesthesia, so you were awake for that.
Oof.
You are asleep and calm and cared for. The patient is actually kind of cool. So when we induce the seizure, um,
Mm-hmm.
we use paralytic so that way the patient's body does not convulse, so that way they don't have muscle soreness and discomfort and all of that kind of stuff. But we'll utilize a blood pressure cuff around one of the calves so that way we can stop the paralytic from going into the foot, and the foot will.
Mm-hmm.
And so we'll see that we induce a seizure that way, but it's very limited, so it's very comfortable. But I think that piece is kind of cool. And then they will just give you small shocks until they hit a seizure, and then once you have a seizure, it stops. Something with a seizure and being postictal, it changes some of the brain chemistry to reduce depression symptoms. It's more for patients with severe depression, psychosis. They will also utilize it if you have severe depression with like high suicidal thoughts. It may be considered more like a first line if it's something that needs to be utilized faster. That
Mm-hmm.
really, really helpful for our patients who have needed that. That is something that I have seen such a night and day difference, like very quickly for, where patients are just so depressed and even we're convinced of like, I don't know if they're going to get better. Like this is bad. We'll send them to
Yeah.
and all of a sudden they are like cracking jokes on the unit and like the life of the party. And you're like, whoa, who are you? And they're just like so happy and thankful. And so that piece is really cool. TMS. And so ECT you'll do 2 to 3 times a week for a few weeks, and then you titrate down. And then TMS is magnetic therapy. So same kind of situation. It can also be used for OCD, but they use magnets, which is very cool. After some brain mapping and your consultation with the psychiatrist and things like that, you have your map, and then they have a magnetic helmet that kind of goes on, and it's a
Mm-hmm.
machine. The procedure lasts anywhere from like 10 to 15 minutes. It's similar to ECT, but we are not inducing a seizure. So the magnets are able to again kind of change some of that brain chemistry and kind of increase some of our endorphins and things like that. And then
Mm-hmm.
patients have to do that. It's usually about 5 days a week for 4 to 6 weeks, and then they titrate down. But patients don't need to be sedated for it. There's no discomfort, there's no headaches or anything like that. So very, very minimal side effects, but also has been very effective for our patients over a long period of time, especially with a lot of like rigidity symptoms where there's not like a willingness to like want to try new things, or in our patients cases like eat or do things like that. That's
Mm-hmm.
effective. And then OCD, that is just such a hard thing to treat, so being able to utilize something else for OCD, because medications really it's a gamble whether or not the meds are really going to help, and you really have to have a patient who's willing to break some of that.
Mm-hmm.
Helping with some of that rigidity is really helpful to have just one other tool. So
Cool. Thank you for breaking those down. I learned something new there. I didn't know about the magnetic helmet.
it's really,
That's
yeah.
so. The next thing that I want to ask you, on a personal level, can you explain the importance of therapy for people who are on the fence? And sometimes we get lost in our ego and we think that we're fine, that we can deal with things ourselves, that we can solve the issues that are floating around in our head, circulating, and then eventually they turn into a negative cycle that we can't break. So, just being able to express why you chose a certain therapy and just how you benefited from it.
Yeah. Um, Therapy, you don't need to be in crisis in order to go to therapy. And I think that's probably the biggest misconception, is that, like, oh, my problems aren't that big. Um, but that is not the point of therapy. Therapy is our prevention. Like, just how we should all be going to like a primary care doctor just to be like getting our checkups and making sure we're not missing anything. That is a therapist. Like, you should have that to prevent these small problems from becoming big problems, right? And that's always somebody then that if you have the big problem, just like a primary care doctor, you get sick, you have that person that you can just connect with real quick. You've got that in, and they know you, and they can help you, right? Same thing with a therapist. When crisis hits, because crisis is going to hit us all at some point, like, life is not that easy. You have that person that knows you and that you trust, because then you have that outlet. And I think a lot of us make the mistake of making our partners or our family or our friends our therapists, and that's not their job. They're our friends, and of course they're going to be there for us, but a therapist is really who that person should be, to be able to, they're there to really give their full attention to you in a really safe and supportive way, and also give you unbiased action to take from that on how to help yourself getting out and what you should do next and all that kind of stuff. But if you are still against therapy, I can't recommend enough that, like, you still need to do something. So whether that be journaling or meditating or something that helps you compress the thoughts that, especially like you said, can really get stuck in a negative loop, doing something to break from that, because that is really where things escalate and things become an unhealthy pattern that really could be preventable and doesn't feel good. So
I love how you say that you don't need to be in crisis in order to go to therapy. I think that is the one big piece of information people should take away from this, is that it doesn't matter if you're in a good mental state or bad mental state. Either way, it's still great to be able to go and talk to someone about things that are going around in your head, even if you're in the highest of moods and you still don't know how to communicate to someone else in your inner circle or your family about what you're going through. It's always good to be able to have someone where you can bounce information off of, and they can give you unbiased feedback, where it's like, okay, I'm not bragging, I'm just simply just saying, how I feel, and someone else isn't going to interpret it a certain way, or vice versa. It's like, I don't want to drag someone down with the thoughts that are circulating in my head that I can't articulate for them to understand, like, the pain or like the suffering that I'm going through. And I think it's definitely something that more people are going to adopt, hopefully. And I see like so many different services that are popping up, especially like post COVID, online services. Like, I myself, I used an online service, and I just spoke with someone over the phone for 40 minutes, and that helped tremendously. And it reshaped how I was thinking about situations. And that was the first time in 33 years that I used a service to finally like get what was happening in my brain out, and like, oh, okay, I'm not psycho, I'm not crazy.
oh, well, and I think that's how there's such a stigma around mental health. I mean, I had it before I switched over into mental health. I did not have any exposure into mental health services prior to this, company that I've been with, and I've been with them, for 4 years now. And walking in and seeing all of the patients were like me. Like, oh, they're like me, they're just struggling. They're just having a bad moment in time and realizing at any point, like, that could be me under different circumstances. Like, something happens, that
Yeah.
could also be me too. And so I think it definitely was eye-opening to me of like, this stigma definitely needs to be worked on. And I think I would love in the future to see, just how we have primary care doctors and we have, pediatricians and we have our annual checkups and things like that. Having that for mental health, especially for our kids, I think could change a lot of the statistics that we see currently, because I think we wait for problems to look so big, and we see kids struggling and we think it's just, it's just hormones, or they're having a tough time in school. And I think it's really easy to dismiss and not realize that there are bigger problems that may not be, spoken about, or may be flying under the radar and things like that. And so I'm hoping that it becomes more normal. I love the shift that's happening with therapy. I'm hoping that, as this continues, the momentum continues, and we start talking about preventative services for mental health and having more opportunity to deep dive into patients' mental health and making sure our kids are okay, parents are okay, all generations are okay. I mean, even with the elderly, there's so many undiagnosed, patients who are really depressed. You think about all the loss that you have in your older, generation and things like that. There's such a need, and I don't think that we're doing a good job identifying that and like not making patients and loved ones feel like something is wrong with them when we are suggesting therapy that everybody should have. It's not a problem. It's not, it's not something you need to be ashamed of. Like, we all should have this as an opportunity. So.
Yeah, no, I love that. I think it definitely is something that needs to be hyper focused on, especially as the increase in technology continues to improve. I think we're going to be less human and more cyborg, and stepping away from technology and disconnecting, just like you're mentioning with ketamine being a dissociative. uh, do the same thing with technology, where you take breaks from it so that you can feel reality actually set in, because we're constantly being influenced all the time by stimulation. So it makes sense why there is a propensity to feel the way that most people feel, and that's like that generalized anxiety, that overwhelming feeling of, like you were saying, the hustle culture of society. So there's always a balance to everything.
Yeah. Yeah. Yeah.
So the last question that I want to ask is, what excites you most about the future of psychedelic assisted therapy treatments?
Yeah. I mean, I think it's just the prospect that, and I know I've said this a few times, but that we're not stuck. Like, there's more that we can offer patients, and that's why we're all in mental health. Like, we want to see them get better. We want to see them have their independence back. We want to see them thriving and enjoying life as they deserve, because they're all good people and they've just had really shitty cards dealt to them sometimes. And so I don't think I know anybody that I work with that wouldn't be willing to try anything for a patient. Like, if there's a new, whether it be psychedelics or a new treatment or there's a new medication or something like that, we get excited because it's something new we can try to help this patient get what they deserve, right? And so I think so exciting to know that more and more are going to become available. And I think as we see the studies, and we would love to see some of, I know that like PTSD and MDMA is like a big conversation right now, and there's been a lot of, good documentation that, patients with PTSD have had dramatic results with MDMA assisted therapy. And so I personally work with a really heavy PTSD population, and I know how crippling it is. And it's something that even when they try to go to sleep at night, they then have the night terrors. Like, they can never escape it. And so your heart just breaks because you're like, you just want to give them that relief and that break. And so I think knowing that there's more that is specifically being looked at for PTSD is just really exciting. And I just really hope that the patients do get relief and get a break, and they get to escape and just have that peace that they are ultimately wanting and looking for. They just haven't found it yet. So
awesome. I thank you for shedding light on this, and also thank you for being someone who is pushing this forward. We need more people like you. We need more educators, especially in this realm, so that more people can understand that these substances administered on a clinical level have benefits, and that they shouldn't just be demonized right off the bat because of people using it recreationally and abusing it. That's with any substance. Like, there is no good or bad drug. It's just a matter of how it's being used and if it's under or overused, right?
I think what a lot of people need to understand, and I think there's a lot of fear from what happened with, the opiate, epidemic and all of that, but these are not drugs that should or would be prescribed to patients at home or anything like that. It really, if we do go this route, it would be monitored with, vital signs and things like that. They would have, treatment teams around them. Like, it's in a safe setting that it really can't be abused. Of course, there's always room for people to not follow guidelines appropriately or do things like that. But I think giving patients the opportunity and not being, scared of that piece, or, being, under the prospect that, like, we're just going to legalize it and everybody can do it. That's not the goal. It's to be able to give it to patients who qualify and who have met certain criteria and who have had a lot of assessments and are safe to get this, is the goal. So
I'm glad that you could expand on that, because it needs to be heard over and over again, right? I think, again, need more discussions on these topics, and just listening to the people that are dealing with it firsthand in the clinical setting, where it's not being, peddled by a company that's just rushing through trials and trying to push a drug to the public. This is definitely, or there's definitely more research required, like you were saying, especially on all these novel substances coming back into light. I think there is a renaissance that's happening currently, especially, just seeing how the cannabis market is evolving, and more regulations, standardizations, all of it's going to be required. So just being able to have people um, that are practicing scientific development and recording data, not just making it up, is going to be it's it's necessary. So thank you. So with the closing questions, I want to, and I do this with guests, I want to ask you, what's your favorite podcast to listen to?
Oh, you're gonna judge me. I think it's just because of ADHD and I just need like constant dopamine. But I love drama, and so I listen to Two Hot Takes. That's like my one where I'm like always excited for it to release, and it's reading crazy Reddit stories. There's always, my psych brain thinking of like, what disorder does this person have? It's like, how in the world would you do? But it's so entertaining. So that's my favorite podcast at the moment. It's not something I nerd out with.
Hey, no judgment. I don't even know what the podcast is, so like that. Yeah, if that's how you relieve whatever is going on in your mind and just like decompress, that's what works.
Always like, crazy my day is, it was not that crazy, so we're good.
uh, what are your favorite books?
Also, anything crime related. I love murder mystery, or even if I can get into like a series on, I've just got like my little Amazon Unlimited. So it's never really the best
Hmm.
books, but I have all of the books at my fingertips that I can just pick and choose from. So a lot of thriller, a lot of, murder mystery, and embarrassingly enough, I've gotten into romance, which I never thought I would, but they are very entertaining. So, and I watch it. So it's just as soon as I get home, my brain shuts off.
It's better than watching like the soap operas on TV where you're actually reading something that is stimulating versus just watching something.
Well, I mean, I do also watch The Real Housewives of Salt Lake City, so
Oh no.
it's something. Don't have to try it.
What's your favorite hobby?
Right now, actually, it's jewelry making. Um, you and I obviously know each other from shuffling, and I still dance and I still love
Yeah.
it. Um, but when I got sick, I needed to take a step back, and I like literally was not allowed to dance or move for a little bit because of my heart rate. But that kind of helped put some things into perspective too of how much I burned myself out. So, I
Mm.
picked up jewelry making, and it is so much fun. It's really nice to have like
Mm.
a creative outlet that's not overstimulating sometimes, doesn't like
Mhm.
get up and move a whole lot. I can just sit down and make whatever comes to mind, and it's really fun. I love it. So that's my number one right now.
That's great. I'm glad that you were able to find another creative outlet that brings you solace. I think a lot of people should find and multiple activities, not just hyper focus on one,
Mhm.
because it gives you various outlets, and then you're just like, if you do get hurt, and it's something physical that you enjoy, then it's like, fuck, what do I do now?
Now I feel like I have so many things at my fingertips. We're doing a paint by numbers kit too, which I highly recommend. That's the first one I've ever done, and it is so relaxing and so much fun. But like anything you can think of that you're interested in, there are kits for it now. Just buy it and try it. Like you don't have to invest a whole lot. See if you like
Mhm.
it, and then deep dive further. But there's just so many things available to us. I think that we just don't realize it sometimes. So
Yeah.
yeah, highly recommend. Anything with is just great.
And then the last question, what advice would you give to someone who wants to get into a STEM career?
Hmm. I guess just go into it for the right reasons. I think that that's where a lot of people get lost in careers because they go after it for the wrong reasons, and then later down the road they're like, I hate what I do. I'm burnt out, I don't want to do it. And I think if you just naturally, and I never thought I would say this about like a nursing job, but I don't feel like I work every day. I genuinely enjoy what I do. I love being where I'm at. And so like
Hmm.
if you go into it for the right reasons, that's the feeling that you're going to have down the road, and that's what's going to actually bring you enjoyment. So, um I think just always challenging like what your why is and making sure that that's in alignment, because otherwise it's going to feel really heavy. It's going to feel like work, and it's going to be something that burns you out later down the road.
Absolutely. I think you hit it right on the money. It's always about the why, especially when it involves something that is related to science, technology. You're going to be challenged, and you always have to come back to the why, especially when things are hard. And then that allows you to reset and reflect, and ultimately pushes you to realize, like, okay, this is where I'm supposed to be.
Hmm. Yeah. Even on a hard day, you're not going to feel like giving up or quitting then because you still have your why.
Well, I want to thank you again, Sammy. This was awesome. I learned so much, and it's great to have another fellow shuffler that is uh, pushing forward their passion with a scientific approach.
Yeah. It was a good conversation. Thank you for having me, Dorian.
Absolutely. Until next time, and there is going to be a next time because I want to have a follow up and see how everything is going. Thank you so much for being here.
Yeah, thank you.
Okay, take care.